with the other conversation going on in this country post-Newtown, aside from gun control, and that's mental health. For families struggling with it, access to help remains an issue for so many. It's out there, we are constantly reassured, but it can be hard to get. We get more tonight from NBC's Ron Mott.
The Connecticut tragedy renewed questions about troubled young men who commit violent crimes, often described as loners, socially awkward, angry. Potential signs, doctors say, of a possible underlying mental illness. 1 in 17 Americans lives with a serious mental illness, and their symptoms range in severity, but fewer than a third receive professional treatment. Fewer professionals are entering the field, and rising costs have reduced the number of hospitals and clinics offering care.
In the reality, it's really the very poor who can get Medicaid, where there's a certain basic level of service, and it's reasonably quality service. And the wealthy can pay for service privately.
Deep cuts to mental health care funding began 2 decades ago. In the last 3 years alone, states have cut spending by almost $2 billion. Like the vast majority of the mentally ill, Pete Early's son, Kevin, was never violent, though had brushes with police as his mental illness became apparent. He was diagnosed at age 22 with bipolar disorder, which his father writes about in the book Crazy, detailing the painful journey his and other families often travel.
We need to fix the system. It shouldn't be easier to get an assault rifle than it is to get mental health care. Trying to get my son help was nearly impossible, and I was advocating for him. What chance is someone who knows nothing about our system, has no money, has no political connections, what chance do you think they can have getting into our system?
Ailments of the body, some argue, are given more credibility and more money than disorders of the mind.
We don't treat the disorders from the neck up the way we do the rest of the body, so mental illness is not equal to physical illness, and this is truly at our own peril.
One of many voices calling for easier access to critical services the mentally ill so desperately need. Ron Mott, NBC News, New York.
Up next here tonight.